Hello and welcome back to my YouTube channel. This is Maureen Sullivan. I'm a registered nurse, certified diabetic educator, and a certified emergency room nurse. A happy belated 2025. I'm kind of embarrassed to say that the nurse here had some health issues at the start of the year that kind of put a wrench in making videos for a few days. So I'm delighted to be back and share with you some more health and wellness tips to get the new year off on a good start here. I have a screen pulled up in front of me here, so if I'm not looking at you, I'm looking down at the screen for this information. But January is Thyroid Awareness Month, and so as a thyroid cancer survivor myself, I just wanted to take a few minutes and discuss some important issues about thyroid health and well-being and refer you to some external sites just to give you some great information to follow up on at your leisure. Anyways, we are in the middle of a massive snowstorm in Middle Tennessee, and I hope that wherever you're viewing from, that you have a little better health and well-being when looking out the window, because right now I'm not feeling it myself here. But all is well here, and like I said, I'm decidedly happy to be back in 2025 and wishing everybody in my viewing audience good health and good spirits across the board here. Okay, without further ado, January, Thyroid Awareness Month, an important time to focus on the critical role that the thyroid gland plays in overall health. The thyroid gland is actually a butterfly-shaped gland located in the base of your neck here, and mine has a scar instead because I said I had my thyroid removed as a thyroid cancer survivor in 2015. And so the information I'm going to share with you is about thyroid disease, not necessarily thyroid cancer, but that is included among the disease processes or disease disorders related to the thyroid gland. So you've probably heard the term hypothyroid and hyperthyroid, and that's what I wanted to focus on. I do want to read something to you because I think, especially if you're a little kind of on the depressed side as I am about the current weather here, you might feel some of the symptoms I'm going to discuss unrelated to, the weather. So hypothyroid occurs when the thyroid produces insufficient thyroid hormone, and these symptoms can result in fatigue and weight gain and depression. In contrast, hyperthyroid, when your thyroid levels are too high in terms of going the wrong direction, leads to rapid weight loss, increased heart rate, and feelings of anxiety. And recognizing the early signs of this disorder is important because there is treatment, medications available, dietary and lifestyle changes, and in some cases, such as myself, thyroid or surgery intervention for your thyroid. So the importance is that it has the ability to be managed successfully with diet and lifestyle and medication supplements. And so that's, I think, the takeaway here. But the important thing is that your thyroid is a vital gland in your body here. And if, as in my case, it has to be removed, medication is available that you take on a daily basis. But the important thing is, like I said, hypothyroid and hyperthyroid are opposite ends of the spectrum on the thyroid levels. And they can, in and of itself, depending on how you're affected by this thyroid hormone, can have anything from feelings of fatigue and weight gain and a depression to weight loss and increased heart rate and anxiety. And I've been on literally each end of that spectrum, and I can tell you that you start feeling like there's a mental health issue going on. And in some ways it is, but it is hormonally influenced, okay? Regardless of what is happening outside. And I look outside, and right now it's rather depressing to me because we're in the middle of a snowstorm. But the important thing is, one, to get checked for thyroid enlargement. That can have your provider actually just do a neck examination or an ultrasound if there's a suspicion there that your thyroid gland is too large. A blood test such as a thyroid profile or a thyroid study can actually pinpoint what your thyroid hormone levels are. The important thing, like I said, is that lifestyle factors, proper diet and nutrition can enhance the function of a thyroid. Medication can overtake the absence of a thyroid or low levels of thyroid medications and hormone levels in your system here. But I think the important thing, especially in January when the weather seems to affect a lot of us, myself included, the importance of understanding that thyroid disorders and mental health disorders may be linked, but not in the way you're thinking. As I said earlier, hypothyroid, when your levels are too low, you can have symptoms of depression, fatigue and just this apathy feeling, and unexpected weight gain in terms of I don't feel like moving, I just feel like laying around all day, have no energy, I'm fatigued. The flip side is that if your levels are too high, you can have heart palpitations, you can feel almost like you're having an anxiety or a panic attack. Regardless of any other situation occurring, that hormone level is causing those feelings. And so it's really important to understand how a simple test, such as a thyroid level, may be the missing link to find out if there is something else causing mental health feelings of depression and or anxiety attacks, panic attacks, apathy, whatever it may be here. So like I said, it's really important. But I never want to leave you just with that information here. Instead, I do want to refer you to the American Thyroid Association. Their website is thyroid.org, and a phenomenal website called thyca.org, Thyca, which is actually thyroidcancer.org. Don't be scared by this cancer wording in the title there. It is a wealth of information for all thyroid disorders, thyroid diseases, thyroid enhanced diet, lifestyle changes, medications, and more so. So thyroid.org and thyca.org are where I want to send you to for more information. But in the meantime, wonderful to see you. 2025, let's partner up and everybody, myself included, let's aim for some better health and overall well-being here. But in the meantime, stay warm, stay healthy, stay in touch. Click, like, share, comment, and I'll see you back here real soon. Have a great day. Thank you.